I'd like to call this meeting of the Health and Human Services Committee to order. First order of business is a Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Great. Next order of business is the adoption of the agenda. Do I have a motion to adopt the agenda? A motion by Commissioner Romano, supported by Commissioner Haw. All in favor, please vote. Or against, you can also vote. Next order on the agenda is the approval of minutes from December 4th, 2019. We have a motion from Commissioner Brown, supported by Commissioner Sauger. Please vote on the adoption of the minutes. Minutes are adopted. The next item on the agenda is public participation. Is there any member of the public wishing to participate? Any member of the public like to speak? Seeing none, we'll close public participation. Moving on to the next item on the agenda is department recommendations. First up is a grant agreement, Michigan Department of Health and Human Services budget amendment from the Health Department. We have Mr. Rella here from the Health Department. Let's know a little bit about this agenda item, please.
Thank you. And good afternoon, Board of Commissioners. The Health Department has received our second amendment to the comprehensive grant agreement with the State Health Department. Within this agreement, they've made a slight reduction in our tuberculosis prevention control program by a little more than $5,900. They have increased our family planning program revenue by increasing the grant by $187,000, and this is going to help us put together a new clinic at our Sacred Heart Substance Use Rehabilitation Center. We're going to add family planning services into the rehab center, and that'll be very valuable for residents at that location. We're also having a slight increase in some of our public health emergency preparedness dollars of $1,100. And a new grant, they are adding $200,000 to expand our nurse family partnership program. This is a home visitation program for first-time moms, and the amendment is giving us $200,000 in a new grant application that we applied for, and had to go through a number of applications to get that new money. So we're excited about that. So we're asking that the board approve Amendment 2 to our comprehensive agreement with the state, which will decrease health general fund revenues by $5,923 and increase our fiscal year 2019-2020 grants by $387,997. And I'll take any questions.
Bill, thank you. Before we go to questions, I need a motion to move this to full board. It is a grant, so Commissioner Romano moves that we move it to full board, supported by Commissioner Leonetti. Okay, we have some speakers. Commissioner Brown.
Thank you. Thank you for bringing the report, Bill. Appreciate it. Good to see you again. The family planning. What exactly are those services entail? That's a touch word. Does someone want to make sure what exactly is that talking about? That's not referring anyone to any abortion services or any abortion counseling services. I think we stopped that in the middle 90s, and as far as I know, we haven't done that. We're still waiting to be sued, by the way. They said we were going to be sued when that happened. It never has.
Again, this is our reproductive health program for women and men. Yeah. We have a little over 1,500, primarily women, participating in the program. Again, it's mostly women that don't have a medical home and are low income, and they receive reproductive health counseling. They receive physicals, healthcare counseling, and contraceptive services. These are Title $10 that come through the federal government to the state, and we deliver this service. We've been providing the service in Macomb County
for many years
since the 1970s.
But to be clear, there's no abortion referrals to any abortion.
No, sir, you are correct.
Just want to make. Someone asked me that question. Just want to make sure that I've been around this board a long time, and we addressed that a long time ago. In fact, my first year on the Board of Commissioners, way back when, and still true. So very good. Thank you very much. I support this recommendation, Mr. Chairman.
Thank you, Mr. Brown. Commissioner Romano.
Well, I think you mean me. Chairman. Oh, yeah? Okay.
So, Bill, I want to make sure I understand this. We're exchanging approximately $5,600 for $387,000. That's a pretty good trade-off. Anytime you have something like that, I'm in. Thank you, that's all I got.
Oh, we never want to see reductions in any of our programs, but the federal government cut some of our TB dollars, and state passes those on to us at the local health departments.
Thank you.
Thank you, Commissioner. Commissioner Leonetti.
Thank you, Mr. Chair. That goes along with my question. Is TB under control? I mean, there for a while it was kind of coming back up. What's your thoughts? I mean, how's Macomb County look? Do we have any numbers on?
Just stay tuned for the rest. Later this week, you'll hear more about tuberculosis.
Okay.
We typically get probably anywhere from 5 to 10 active cases of TB, but we also get latent cases of TB where people are not exposing any symptoms, but they have the bacteria. Sometimes a latent case can become an active case due to a number of circumstances. But right now, we're working with the state. I'll just give you a heads up. We're working with the state of Michigan and one of our health systems in a situation where we're going to need to test a lot of people because there was exposure to an individual with active TB. And you'll be hearing more about this week as the state's going to do a news release. But,
Okay,
it is a disease where a lot of the TB cases coming in, and sometimes they're drug resistant and are much more difficult to treat. That's why we have a medical director and an active staff in our TB program that work in observing people take their medications, working with other professionals at the state who have expertise in tuberculosis, because we still see cases not just here in Michigan and Macomb County, but throughout the country.
All right, so after your report later this week, I might ask you some more questions about this reduction then. I guess that's probably the best way is to hear a little bit more about what you say later on this week, right, I assume? Okay, all right, thank you, Mr. Chair.
Thank you, Commissioner. I see no other speakers, so seeing none, we will vote on the motion. Okay. Motion passes. Thank you, Bill, very much. Appreciate it. Good work.
Okay.
Okay, the next item on the agenda is a budget amendment from Macomb Community Action, Office of Senior Services, Adult Daycare Services. No? You're right. Stay up there, Bill. I'm sorry about that. All right, great. Well, then, what we'll accept then is a motion now for the Health Department Nurse Family Partnership Program, and then we'll have Bill speak to that. We have a motion made by Commissioner Duge, supported by Commissioner Myjack. Okay, thank you. Why don't you move on to that motion then? Thank you.
Okay, as approved just now, the Health Department's new grant for the Nurse Family Partnership Program of $100,000 for the remainder of this fiscal year is to expand our Nurse Family Partnership Program. Now, this is a pass-through of federal dollars to the state, and these funds have to be reported on a fiscal year calendar basis, which is October through September. Now, Finance has recommended that the existing revenues and expenses in the general fund side are transferred to the Health Department's fiscal year grant funds, which will ease reporting and tracking of the NFP program's fiscal expenditures. This transfer has no required changes in our general fund support for the Nurse Family Partnership Program, and will create a savings of the use of the fund balance by $124,500. So the Health Department is requesting the board approve a budget amendment to transfer our NFP or Nurse Family Partnership Program Health Department's general fund to the Health Department's 2019-2020 fiscal grant fund. So it's just moving the funds over to the grant side that are supported by the general fund side, so we can better report and keep them together. And this is recommended by Finance, and that's why you see some of the numbers moving in this recommendation.
All right, I don't see questions. Am I missing anybody? Nope. Yeah. Who made, oh, yes, Commissioner Carabelli.
Thank you. Real quick, I see on here, on our page, it says a 498, it's a wash. But I'm looking at these numbers and the increase and decrease of the general fund. Okay, I don't want to belabor this. I'll look between now and full board, but the numbers didn't add up right to me, but I'll just double check.
Okay. And I'm sure our fiscal people can explain those. Some of those revenues are other grant dollars we have from another source.
Maybe that's why I'm
That's
confused.
that $30,000, which is,
Right.
so some of those are other funds that are being moved over to the grant side. To the
So
grant
then,
side.
just for the record, so I'm clear, at the end of the day, the general fund is no change.
Correct.
It's an even Steven. There's no credit or debit to the general fund after this action.
As it currently stands, it'll actually be a benefit to the general fund of about $125,000 because we're taking 100% of the funds out of the general fund and only replacing them with 75% through September 30th. So at the end of the day, through September 30th, we'll have $125,000 more going into the fund balance of the general fund. And we'll probably come back to you with another budget amendment for that remaining 3 months of 2019. At the end of the day, it'll be a wash. So, end of the day, zero impact on the general fund.
But, okay, so just so I can understand, so when I look at this as a net, but are we talking, will that then affect the 2021 budget to pay back that difference?
No.
It'll still be in the calendar year of 2020?
No, it'll be in the grant fund on an October through September year end. And we'll have to fund that program starting October 1st again with replacement dollars. But at the end of the day,
Okay,
It's a wash.
I'll talk to you after the meeting.
yeah,
Okay,
it's a
thank you.
wash.
Thank you, Mr. Chairman.
Okay, any other commissioners? Seeing none, please vote. Okay, the motion passes.
Okay.
This time I think you are done, Bill, so thank you very much. All right, next, we do have the budget amendment from Macomb Community Action Office of Senior Services, Adult Day Health Services for $340,000. We have Gary Cutler and Shelley Cote. We have a motion made by Commissioner Brown to move it to full board, support by Commissioner Sauger. Gary, you want to give us a little background?
Certainly. So the budget
Sheila?
amendment you have in front of you is because of the way we have changed the services done at the Goldenberry Adult Day Center. So in the past, it was a partnership between Martha T. Berry and the Office of Senior Services as part of Macomb Community Action. As Martha T. Berry was losing money on the operation, we have changed to a contract with them where we're paying them for services, and we have taken over the collection of the private pay and the veterans that are there. So we're paying Martha T. Berry for providing the services, and we're having the clients pay for these services. So instead of Martha T. Berry having the responsibility for the non-grant portion of the people at the Adult Day Services, Macomb Community Action is running that. We've got a contract in place to pay them per hour of service that they provide to the clients, and then we're billing the clients for those hours of service.
Okay, we have one commissioner, Commissioner Carabelli.
Thank you, Mr. Chairman. Can you quantify if they were losing money performing that service? Now that they're not losing money, can you roughly, and I won't hold you to it, just an approximate dollar figure per year?
Yes, I have Sheila here with me. When she came on board and we looked at this here, in my belief, Martha T. Berry was not fully billing for the costs of the services provided. We looked it over. Sheila has sent to the clients a letter. We're having the clients prepay for the care, the private pay clients prepay for the services. The veterans, we're still billing after the fact, but we've set up a process to cover our expenses.
So for the private pay consumers, they were paying about $12 per hour, and the state going rate is $17 per hour. So we increased that rate to $15 per hour for the private pay individuals. We didn't want to price anybody out, but, so we
And I
tried to
appreciate
keep
it.
it
So,
reasonable.
I don't know
Yeah.
if they see one or if they see 1,000. Do we have a rough idea of last year, how many we're seeing? So the increase of, would you say 11 to 15? Right, so
Right.
we have a $4 increase. Do you know how many patients or how many hours were utilized the previous year?
I have that information, but not with me. Last year, Martha T. Berry lost roughly $75,000 on this operation and couldn't continue in the partnership in losing money for this type of program. And when we evaluated and looked it over, we felt that the real issue was the private pay portion, not, we were running the grant portion of the clients through a partnership with AAA 1B. That didn't seem to be the problem. The problem seemed to be the private pay side. So we've brought them into Macomb Community Action, the services, and we're handling all the revenue side of it also.
Okay, thank you. Then the last question I have, you mentioned veterans being served out there. Is that something that goes to our young lady that's sitting nodding? No?
The VA, Department of VA.
So it's a VA that handles, okay, thank you. Thank you, Mr. Chairman.
Thank you, Commissioner. Commissioner Sauger.
Yeah, just curious, how many veterans are over there?
I think we have about 3 or 4 in the dementia care
Okay.
adult day.
Thank you.
Yep.
Thank you, Commissioner. Any other commissioners on this question? Okay, we have a motion before us. Please vote. Motion passes. We've got a next agenda item. By the way, is it Sheila Cote? Is that correct? Cote? Okay, thank you. The next item on the agenda is Macomb Community Action Children and Family Services Great Start Readiness Program for $170,520. So do we have a motion for that? We have a motion made by Commissioner Haas, supported by Commissioner Duje. Gary, go ahead.
Thank you. So we have been in partnership with the Macomb Intermediate School District for a number of years, and we were providing 120 children Great Start Readiness Program. This grant is effectively being extended by an additional 48 children, which is bringing us another $170,520 into Macomb County to help pay for the programs that we're running through our early Head Start and Head Start programs.
Okay. Okay, and no speakers? Seeing none, please vote. Okay. She'll assume the motion passes unless told otherwise. Yep. Next item on the agenda is the budget amendment from Macomb Community Action Children and Family Services, supportive services for veterans' families for $291,166. Do we have a motion? Motion from Commissioner Ha, supported by Commissioner Sauger. Go ahead, Gary.
Okay, so the Specialized Services for Veterans Family was a program that Macomb Community Action had years ago through a partnership with the Community Action Partnership out of Washington, D.C. We no longer were receiving that grant. However, Oakland Livingston Human Services Agency is receiving a grant for a number of years serving the veterans. They got additional money and are expanding services into Macomb County. So what you have in front of you is 2 contracts. One they gave us during a startup period while we were submitting documentation, and the second one. The 2 of them combined for $291,166, and that is to provide services to veteran families in Macomb County, something we did before but weren't currently doing because we had funding had went away.
Okay, we've got one commissioner so far, Commissioner Smith. And then Carol. Go ahead, Carol.
Mr. Chairman, if you can give me a little bit of latitude, I just want to ask one quick question on the last item since he's still up here.
Go ahead.
Those funds that you had mentioned, is that for a position? You said 48 children. is that actually for an actual, not for the children, but for the position of an individual to service those children?
No, those are for children that we service. So we're serving children. So what we're able to do with the Great Start Readiness Program is to provide full-day services instead of, so our Head Start programs, we have two different styles of classroom. We have what we call a stat classroom, where we have morning and afternoon sessions, and then we have full-day sessions. By getting these programs, we're able to provide a full day to the same number of children in the classroom, but we're able to provide full-day services
And
instead of part-day
the reason I
services.
asked that, because it said salary and fringe of 168,520, and then operating expense of 2,000 for a total of 170,520. Unless I'm looking at it wrong. Yeah, it's actually, on the breakout, it tells us that it's going for salary and fringes of 168,520 and 2,000 for operating expense, which equals the 170,520. That's why I asked if it was a position.
No, actually, without this funds, we would have had a lot of trouble paying for the class and comp study. So this is actually just the current staff. We haven't added staff to do this.
It's to cover the wages of somebody doing the work.
Yes.
Okay, thank you.
Again, a couple $1,000s for additional supplies because they're going to be in the classroom longer, but.
Thank you, Commissioner. Chair Smith.
Thank you. Gary, I notice a familiar face I haven't seen in a while in the audience. I don't know if you'd like to reintroduce Mr. Ernest back there. You want to come and say hi? I mean, we'd love to. I don't know if everybody remembers Ernest.
Yeah, thanks, Bob. Appreciate that. Ernest Colby, Director of Macomb Community Action. Very grateful for the work of the commissioners and oversight of our agencies. And, you know, a lot of the between-the-lines story of our budget items here today are our legacy of splendid work across a variety of programs. Unstacking classrooms is so important. For a lot of our low-income families, when their kid gets a half day in class, they have to think about how they're going to pick them up and how they're going to cover that extra half day. Full day services are really the full dose to make sure that we're transforming kids' lives with our excellent curriculum and support staff. And that goes for the senior service office as well, and our children and family services through the supportive services for veterans and families. It's really just a great legacy we've laid in Macomb Community Action that leads funders and grantors to know we provide an excellent level of service and we're a wise steward of funds. So my privilege to serve with Macomb Community Action.
And Ernest, I just want to say we're glad to have you back.
Yeah, thanks, Bob. Appreciate it.
Okay, Commissioner Romano.
Thank you, Chair, and Gary. Gary, I'm reading here where it says you provide this supportive services for low-income veterans and their families. What actual supportive services do you provide?
Okay, so effectively, when we first got this grant, it was different to me because we hadn't done the level of case management that we're required to do in the specialized services for veterans and family. So a lot of it is casework, and we have some wonderful case workers on board that we've had in the previous program, and then we've brought one back currently as a contractor just to get us up and running. But so the case managers go out in the field, they find the veterans, generally homeless or in risk of becoming homeless at a point of eviction. They get these people housed. They do case management on, getting their driver's license, getting all their paperwork in order. I was just looking at today the list when we put someone in the house that we're giving them dish soap and we're giving them towels and sheets, and we're getting them. So under the homeless program, there's a stuff called Housing First. And that's something that's emphasized here in our veteran services. We take the person from living on the streets and get them housed and get them set up, and we do a lot of case management with them to get them established back into society.
Thank you very much. That's all I have, Chair. Thank you.
Thank you, Commissioner. I see no other speakers.
Mr. Chairman,
I
I apologize, just real quick, if I may.
Sure, go ahead, Commissioner.
Do you work with Ms. Rios in conjunction, all the services and casework? I know what she does, and is there a lot of collaboration going on here, which I'm guessing there is? 'Cause she's not-
100%. So basically, it's what that whole pot of money is for is prevention of eviction and rapid rehousing once they're homeless. So that's two things. I have one case manager that works with that program all day, every day. The only thing is, we, as a Veteran Service Office, cannot have that grant. That's why he has the grant.
I'm glad you're both here.
And that's why we're buds. But, hey, and it's not only that program that he helps with 2 other programs, so.
Thank you, Gary. Thank you.
Okay, any other commissioners? Okay, seeing none, please vote. Thank you, Gary. Next up, we've got a number of items with Chief Randazzo from the Animal Control Department. I'm wondering if anyone would be interested in putting forth a motion to take up items G, F, and H and move them to full board. There are 3 contracts from Mount Clemens, Sterling Heights, and Warren. We can take them up as one. Commissioner Sauger makes that motion. Commissioner Joe makes a second. So Romano. I was desperate thinking. It is, you know, you lose it at the last second. All right, so we've got all 3 up at the same time. If you want to address in any way you feel is most rational.
Sure.
Either one at a time or all at once, whatever you think makes most sense.
Sure.
Thank you.
Good afternoon, Commissioners. These are our annual contracts that we have every year with the cities of Warren, Sterling Heights, Mount Clemens, and East Point. And we're still waiting for East Point to send theirs back. Has to go through their process and their end through their city council. But these are their annual contracts. They set up service fees only, so this is what would be charged to that municipality for using the services at Macomb County Animal Control.
Are there any questions for Chief Randazzo?
I'm like, we knew that was coming.
I don't see them. No?
She likes me.
Okay, great. Commissioner Carabelli.
Thank you. Hey, Chief, did
Yes.
you ever figure out in your budget about buying the new, come si chiama?
The
Assist?
what? Yes.
Assist for your employees to get the dead carcasses off?
Yep, so we found out what happened. There's a prong for the wench, and one of the prongs broke, so it's over at Roads Department on 15 Mile. So they're looking if they could just replace the hand remote to it, because that's what's actually broke, is that hand remote, so you could stand outside the truck and work with it. So they're looking at it. If not, we would replace it. So I've been working with
Okay, because,
Roads.
you know, I don't
And I agree with you.
advocate spending money, you know, when we don't need to, but to see those employees lifting up a dead rotten carcass and they're trying to carry it onto a truck and then there's a hoist that's sitting on the truck and it's inoperable.
Right.
I think you need to buy them one, and if we need to help in any way, let us know, because.
I appreciate that. And I definitely, like I said, right after talking with you, it's over there getting work done, and I definitely will come to you for that
Thank you.
as well. And I appreciate that, because they are heavy.
Thank you, Commissioner. Commissioner Kleinfeld.
Thank you, Chair. Commissioners, I put something in front of you that gives you a picture. The front page is really all you need for the picture. The column A, none of those entities have a contract of any kind with the county, but they also pay for none of the services and receive all the services. Column B, they do have contracts with the county, but they pay for a percentage of the cost of the staff. The staff is correct at our offices.
Are we going with the contract, or you're going off this paper, is that right?
Oh,
Are we gonna-
A doesn't have a contract. I'm saying B has a contract. Yeah, my
Right.
questions are relative to that, but you'll need
Oh.
this sheet for my questions.
Gotcha, okay.
So I'm just explaining to them what it is, because they haven't seen it
Gotcha.
before. And you don't need it for any decision-making. I'm not anticipating that you need this for anything today. I just want you guys to understand my questions. So Roseville and St. Clair Shores have contracts. The contracts, I don't know if Roseville has the newer contract. St. Clair Shores has denied the new contract. It's the same contract that was in front of East Point, and East Point said no. So they've got a continuation of their existing contract while we're looking at that. And then C, these 4 entities, and this was important to you, Commissioner Romano, because you thought it was just Roseville and East Point and St. Clair Shores. all of these have their own, but they pay for all of the services that are in these contracts, the dollar amounts that you see in front of you today, and nobody in A pays for any of those. So I just wanted you to have that picture. So my questions for you is, we already talked about Section 8, so if that's a mistake, I don't think the cities would mind you taking out that animal control officer. And you already explained why East Point isn't in front of us. I didn't get a chance to talk to anybody there. So on the contract, Item 2 is all of the fees associated with those 4 entities. There are also restrictions on animals that you won't take, or that they have to make their own arrangements, like pregnant animals and things like that, or animals that need medical care and they have to make their own arrangements. Do the entities in column A of the thing that I gave you, do they have to make their own arrangements when there's an animal that needs medical care or is pregnant or something of that nature? The ones that you won't take from those 4, do they have to seek their own in those situations?
So I think what's important to point out, just to reiterate, in column A, so if we took Clinton Township, right? Clinton Township historically has never had their own animal control.
Correct. I'm not trying to correct anything today.
So the
there were
question
just
to
some
me is-
things that I didn't know.
Right. And I just want to make sure I'm projecting it properly. And one of the things I just wanted to point out to answer your question is, do the cities in column A, do they pay for veterinary services that the cities in column C would pay, correct?
No. I understand that answer. There are restrictions for the ones in column C that they cannot bring to you. I just wanted to know if the cities in column A can bring those animals to you.
So currently, the cities in column A would be able to bring us animals if they needed medical care to be euthanized. So we couldn't provide medical care to them because we don't have a medical care facility. So if the Clinton Police brought us, which is one of the cities in column A, brought us a dog that was hit by a car and we had to humanely put it to sleep, we would do that. We would also do it for the cities in column C, as long as the city in column C, again, is setting the service fee, understood that there's a fee to that
This
service.
might make it a little bit more clear, because I might have not been clear enough. I apologize.
No, it's okay.
In number 3 of the contract, not number 2, you will not accept any animal that is injured, requiring immediate veterinary care, pregnant nursing, pepper sprayed, animals with taser prongs attached, injured by motor vehicle. Do you accept those animals from the items in column A? And I'm not passing any judgment.
No, I know.
I want you to know, I know that there's going to be discussions. I'm not trying to fix anything today. There's some knowledge, there's some things I just need to know.
Yeah, so this makes it clear.
So the things that you do not accept under any circumstances from those 4, do you accept from column A?
Yes.
Okay, thank you. I appreciate that, because I didn't know that. And then, so so that's the animal care, as well as the restrictions, the things that you won't do, you won't even do for those, you will do for those. And I only need to get this information so as we move forward and we try to fix some of those things. And then my last question is, we know that there is a charge for these 4 for the pickup of animal remains, or the drop-off of animal remains, and there isn't for the other communities, but they have to call to have you come pick up remains. Are the communities that are in column A, do they have to call you and say, we have remains that need to be picked up, or do you have guys out there that are patrolling that pick up remains as they see them?
So for pickup remains in the cities in column A, they call us.
Okay, that's all I needed. I know that we're in serious discussions in fixing it, so I'm not passing any judgment, but I did want to know, because there are things that those 4 cities cannot even receive that all of the other cities not only receive, but they don't pay for. Thank you, and I appreciate that there's some movement on this. Thank you.
You're welcome. And anything I could do to help, let me know.
Thank you, Commissioner. Commissioner Ha.
Thank you, Mr. Chair, and Chief, you can help me a lot with a clarification here, because you started to answer the question. The communities in column A are provided the service at no cost to the local unit. There may be some rationale or history to that. Could you explain that?
Yeah,
please?
so when I arrived here in 2013, the cities in column A, excluding Roseville and St. Clair Shores, they did not have their own dedicated animal control officer. So historically, Macomb County Animal Control has always provided services, animal control services, to those municipalities. The other cities, which did at one time include Roseville, St. Clair Shores, Warren, Sterling Heights, which is where I came from, and East Point and Mount Clemens, they had their own animal control as part of their own municipality. And it was operated through their police department or their city department. And then the city of St. Clair Shores and Roseville eventually wanted to sign on a contract for Macomb County Animal Control, where we truly provided a dedicated officer to that municipality. And it was only for that municipality. So when we look at these cities that are in column A, there's never historically, to my knowledge, ever been an animal control officer providing animal control services other than the county portion of it. Does that help out?
A little bit, because as you're from where? Sterling?
Sterling.
I'm from Roseville.
Okay, yeah.
I know this was a very contentious issue with the mayor and the council. I don't quite remember why, but I'm sure I'll get explained to me as we progress with this. But you have a notation, or I'm assuming this is your document?
I requested that last February, and we had a meeting recently, and Steve thought he sent it to me back then, and he had not, so he just.
Okay, I just don't want to refer to it as the chief's document. There's a statement in here referring to, if I'm reading it correctly.
Are you talking about the actual contract or this page?
Oh, he doesn't
Oh.
have the back to it.
Okay, I don't have the back.
Well, then
But
it
that's
makes-
okay, I'll try.
Okay, then I'll.
Here.
The statement on the last page referring to Roseville and St. Clair Shores, I'm assuming, these two jurisdictions locally issue control animal control licenses and provide the revenue for these licenses to the county. So they're issuing the licenses and providing the revenue to the county?
So for the cities of St. Clair Shores and Roseville, which is like we're referring to, there, like, so for Roseville, part of that contractual agreement was that to make the actual part where Macomb County Animal Control is going to take over their services, so that the residents were not impacted, we still let them sell their dog licenses at the City Records Bureau.
Mm-hmm.
We also sell them, at Macomb County Animal Control, and then through the contract, I believe that there's a credit to them as well.
Oh, there is a credit
Right.
back, okay, because that's not quite the way that read. And second, the next paragraph, summary, all communities in the county have the same opportunity to utilize all of our shelter services, no differentiation, but the 5 counties of East Point, Clemens, Roseville, St. Clair Shores, Sterling Heights, and Warren pay us for the service. What service is that?
So the services for those 4 communities are listed here in that contract. So for example, board days, humane euthanasia, owner surrenders, so anything that they're bringing us an animal, all this contract does is set service fees. In the contract, it talks about how we're not obligated to take any animal, right? But it's just specifically to set service fees. If you bring us an animal, this is what you would be charged. So it's just it's outlining expectations.
Okay. And on today's agenda is approval for Mount Clemens, Sterling Heights, and Warren.
Correct.
So the other communities we're going to come back to, or we're not coming
So
back?
we're just waiting on East Point.
Okay.
But I already had started the process, so I was able to get all 3 of these contracts on this agenda. So I just have to wait for East Point. So we'll come back through.
Well, I'm gonna see the mayor tonight, so I'm sure I'm gonna get the earful from Mayor Taylor of why this is the way it is. Because I do remember there was like 3 council meetings in a row where the animal control issue, because they did have one in Roseville and then they didn't, and then now I think they do. So I'm sure I'm coming back to this for Roseville.
Okay.
Thanks.
They like our service though.
Well, that's all I want to hear.
Right.
I don't go around creating issues if
No, I
there's no
know.
issue.
Yeah, I mean, I think Macomb County Animal Control is, in general, we provide a great service. And I think that's why a lot of the municipalities desired our service. And so far we did take on the responsibility of providing services to Roseville and St. Clair Shores.
Well, I haven't heard this subject come up in over a year, so I want to make sure that we're on the same page here. Thanks. Thank you,
welcome.
Mr. Chair.
Thank you, Commissioner. Commissioner Leonetti.
Thank you, Mr. Chair. Chief, good to see you. Thanks for solving that problem in St. Clair Shores with Lucky the dog.
Yeah, anytime.
Any event, looking at this chart, and I don't know if, Steve, I don't know if you pay attention to this question. You might have an answer for me. I don't know. I don't know if you have it or not, Chief. So when I look at column A, the first part is obviously townships. So are they funded in a different way? Do we get like Public Act 51 money for that, or this is all out of the general fund? So the county on the general fund's expense takes care of the townships. Okay. So the issue is really, some of these townships are getting general fund money, and then other ones are entering into contracts for services, so.
Correct.
Okay, all right. I just wanted to know if there was, if we could take this part out because there was some other different funding source, but apparently there isn't. All right, thank you. Thank you, Mr. Chair.
Thank you, Commissioner. Commissioner Romano.
No, we hit the button.
Happy with the dog comment. Commissioner Kleinfeld, the second round.
Yeah, I just want to make 2 clarifications. In Steve's thing to us that Commissioner Hahn just asked about, he says, in summary, all communities have the same opportunity to utilize all of our shelter services with no differentiation. If you look at item 3 on these contracts, these are restrictions that those communities cannot utilize our services even for pay, that all these other communities not only utilize, but they don't pay for. So they're not exactly the same. There are restrictions. And then the second one is with respect to the dedicated officer. Even if those communities, and I know because they're talking to me and they're pretty upset, even if they said, as the chief of police in St. Clair Shores says, fine, I don't need a dedicated officer. Clinton Township has a lot more pickups than we do. We just want somebody to come down and pick up when we call too. That is not offered to them. So this doesn't hinge on the dedicated officer. It is not his fault that this has happened. There's a lot of history. It's just, it was brought up 2 years ago and there hadn't been movement. And so we had a meeting just coincidentally just last week on this issue, and the movement's going to be slow because they have to start letting the rest of the county know that they're not going to get this for free forever. There's a very large part of the county that isn't. If you look at Mount Clemens, St. Clair Shores, Roseville, East Point, Warren, and who am I missing? One more. Anyway, all those communities are paying for something where the other communities aren't. But I just wanted to correct those 2 things because there are services we have that cities and townships are using that other cities can't even use even if they paid for. Thank you.
Thank you, Commissioner. Commissioner Carabelli.
Thank you, Mr. Chairman. And I'm not going to put you on the spot. If you don't know the answer to this,
That's okay.
get back to me.
Yeah.
I'm looking at a little trend on the list that Commissioner made up. And I'm looking at it almost like I look at Act 51 money. I look at it as that the cities are responsible for taking care of their own roads. The county is responsible for taking care of the township roads. So as I look at the townships, I say, okay, I think, I'm not saying I'm right, I look at it as the way the government is set up for road dollars. Cities are responsible for their own stuff because their cities are incorporated, or how all that works. So as I went down through it, and all the ones with contracts are all cities, I'm looking at a couple of them like, I wasn't sure if Grosse Pointe Shores was the city part of us, or what, well, they are a city, but I looked at it, well, there's 3,000 residents. I looked at Memphis, it's 1,000 residents as a city. So I'm sure there's something part of that. So there's gotta be some type of rule, because like I said, I look at it as Act 51, municipalities that are cities or incorporated look like they have to have in charge of their own animal control by law. And I look at it as townships are still rural, because they're townships, they're not incorporated into a city yet. So if you can find out, I'm sure there's a rule in there, because certain cities are required by their charters and by state law, I believe. And again, I'm not sure, but when you get a chance, if you can look into it, I think that may help a little on this too.
Okay, I'll look into that for you.
Thank you, Mr. Chair.
Thank you, Commissioners. Are there any other Commissioners with questions? Seeing none, we have a motion before us. Please vote.
Is this for all of them?
Yes, all three of the motion. The motion passes. Thank you, Chief.
Thank you. Have a great day.
You too. Take care. Okay, next up, we have item number 7, presentations. We have a presentation for Veteran Services fourth quarter report from Laura. Thank you, Laura.
Hi, how are you? How's everyone? So this is pretty much my annual report, consolidating the calendar year. There's a couple things that we're changing. I just have a service officer that is basically sick and he's leaving, and I'm going to move somebody up into that position because it's more of a supervisor level. And then, other than that, tax season starts, and we added another location. So we have 6 locations in our county, and that will all feed into the grant that I apply for the IRS in May. So that's due in May. Because the more work we do, the more if the numbers keep going up, then there's a good chance we'll get a grant. And then the last thing I wanted to bring, and I did bring some small little handouts for that because I just got these. And so for our service-connected disabled veterans, they now have access to Selfridge, to the Commissary and BX, but there is a checklist that you have to do before you just show up at the gate. So they actually want you to have your Social Security card, your driver's license, your proof of insurance, vehicle registration, before they allow you to access. And if you've ever been to Selfridge, that's a normal thing at the visitor's gate. But the VA worked diligently to get all service-connected veterans at 0% or higher eligible for Commissary and BX privileges. So you have to have that VA healthcare ID card that says I'm service-connected. So the veterans in the house, if you have that VA ID card, you need that plus a couple more items to go to Selfridge main gate to get approval to get on the gate and on the base. And then you'll be able to shop at the Commissary and BX, which is cheaper than Aldi's and Walmart and everywhere else, and not taxable. So that's the latest change that changed on 1 January. But I just got this handout like a week ago from St. Clair County, actually created it because they had so many people turned away at the gate. So other than that, any questions?
Okay. Well, before we get to questions, I do need a motion to receive and file. Motion made by Commissioner Romano, supported by Commissioner Myjack. Questions of Commissioner Romano?
Thank you, Chair. Hey, lady.
Hey.
Just a question on the eligibility to Selfridge. You said disabled veterans are now eligible to enter Selfridge with certain information. Is there a percentage of disability, or is it any disabled veteran with any percentage of disability?
So as you well know, the VA rates their disability. So the VA rates the disability 0% or higher.
Right.
Most people with hearing loss are rated at 0. So you are service connected, you won't get a check, but you are service connected and you get those free services at the VA. So if your VA healthcare ID card says service connected, it never says the amount next to it. So like the 100% vets, it doesn't say service connected at 100. Mine just says service connected, and I'm at 80. If you're at 10, it's just going to say service connected. If you're rated at 0, it's going to say service connected. That's the ID card you need.
And where do you get it?
So the VA, you have to register for healthcare at the VA to get that healthcare ID card. Then you take that plus your extra little articles.
I'm a little lost here. So you're saying register at the VA,
Okay, so if you're service connected disabled and the VA is paying you a check,
right?
okay, not everybody uses VA healthcare, but you now have to register for VA healthcare to get that VA healthcare ID card.
What if you don't need the VA healthcare?
You still need to register to get the ID
And
card.
where do you register? Don't tell me the VA again, please. Where
In
do you
Detroit
specifically
VA
register?
Hospital.
You have to contact the VA hospital? You have
No,
to,
you have to go in person to register, or I can fax the application. But if I fax the application, you have to go and get your picture taken. It's like going to get your driver's license.
It looks like Joe, right here.
Yeah, so you have to go in
I
person.
got all the information I need, thank you. I got it right from that man.
Yes,
He'll
so
get
you
it
just
to
have
me.
to go in person, register, and they'll take a picture and mail you your ID card.
I'll take him with me, thank you. I got
There
it.
you go. And we provide free transportation 5 days a week.
Mine will
Thanks to
come with me
Macomb
to take a
Community
ride.
Action.
Thank you, I
So
need the
there you
drive.
go. And the last other thing I forgot to bring up was our grant, our MVAA grant. They are sending us the criteria this week on to apply. But talking with Oakland County, he went to a meeting last week, and we're getting more money than we got last year. Bummer. Okay. So it's good. I mean, I'll be able to spend it on advertising that gets more veterans in to get more money. So as you see, if you look under number 11, federal claims back pay and federal claims reoccurring, we kind of did better than last year for the whole the whole calendar year. So that's our goal. Help our veterans get money that they so are entitled to.
Okay, Commissioner Dujay.
Thank you, Mr. Chairman. Laura, you're doing a bang-up job there. Couldn't be prouder of you, couldn't be
Thank you.
happier of the job you're doing. Question, as far as the taxes and so on and so forth, are you doing any of that at the Thompson Center in Warren?
Okay, so Macomb Community, my 6 locations does not include the Thompson Center, but Macomb Community Action has a partnership with the County Aid Society. They're there Tuesday, Wednesday during the day in Mount Clemens, and they're in the Thompson Center on Thursday and Friday during the day. Most of my sites are evening.
So there will be information if veterans
We have the
go
same
to the-
flyer. We have the same flyer. So
Okay.
the same flyer, Macomb Community Action and I use the same flyer. We count it the Macomb County Tax Program, so it's not veterans,
Okay,
it's
fair
everybody.
enough.
But if, the difference for veterans is we take the income limit off the table, where for the rest of the constituents in the county, it's 55,000 and below is what's considered low income.
Okay, I just wanted to know if there was, can I get a list of locations?
I can email that.
If
I
you
can do the
email
flyer. I can do the
that to
flyer.
me,
I can email you the
I'd really
flyer.
appreciate it.
Well, how about if I send it to Mr.,
Send it
to these guys, and then they
to
can forward it
Keys,
to you.
and Keys will let everybody know.
Yeah.
That would be perfect.
We're at the Romeo, this year we're taking over Romeo Plank Clinton Township Library. Last year they did it themselves and they were not successful, so we assumed their location.
Have you thought about doing some of these things with the county clerk when he has some of his
The
meetings?
show cause, you mean the show cause hearing that was just?
No. When he
Oh.
has some of his meetings outside of Mount Clemens, the mobile office business.
You know what? I can easily give them my flyers, but we're all run by volunteers. So it's very hard to pick up
If
volunteers
you-
and say, hey, let's go there tomorrow.
And
you know?
that, I understand that,
Yeah.
but I think it would be a good idea if you got in touch with him. And when he has his mobile office, to have
Perfect.
flyers to hand out in wherever locale he's at.
I can do that.
Great idea.
Great idea, exactly.
Thank
I
you.
will do that.
Thank you, Mr. Chairman.
Okay.
Thank you,
so-
Commissioner. Seeing no other commissioners with questions, we have a motion, please vote. Okay, motion passes.
Thank you.
Laura. Thank you. Next item on the agenda is the Martha T. Berry monthly report. Kevin is not feeling well today, so he's not able to make it to provide that report. So we're going to push that item off to next agenda, to next month's agenda.
You need a motion to do that?
No, I'm just going to do it.
Gotten power hungry lately.
But I do need a motion for correspondence, if you'd like to make that motion, Commissioner.
Sure.
Items A in their entirety?
Yes.
All right, go for it. Commissioner Duje going big. Phil Kraft is going big with them. We have a motion, all of them in their entirety. It's go big and go home. Any questions on this motion? Seeing none, we have a motion. Please vote.
He's like a cheerleader. Let's go big.
Motion passes. Next item on the agenda is new business. Are there any commissioners with new business?
Just one thing.
We have one thing, Bob from Commissioner
I'm not gonna turn my microphone on.
I'm going to hold you to one thing, but turn your
Love
microphone
it
on.
when Jim can't think of words and he starts speaking Italian because I'm gonna be fluent within a few years. I absolutely love that. Thank you.
You don't want to be
I love it. Thank you. That's awesome.
All right, Commissioner Romano has a comment.
Thank you, Chair. Just, I want to give a shout out to Brian Santos. I had a resident in my subdivision actually knock on my door and commend the road commission as he was coming down to enter our sub, which is off of 16 Mile Road. He saw a piece of concrete that had pulled up from the 16 Mile Road at South Metro Parkway. He drove home and he sits on the corner of just about 16 and Dodge Park. And he called the road commission and he said he actually could see 16 Mile Road. Within the hour, they were out there and patched it complete. He said, what a great job, but within the hour. And I just wanted to bring a shout out to Brian and his crew that they do pay attention. They do want to make sure that our residents stay safe. And I certainly appreciate it, and so do my residents. Thank you.
Thank you for sharing that. It's good to hear. Are there any other commissioners on a new business? Seeing none, we move on to public participation. Are there any members of the public wishing to speak? Once, twice. All right, we'll close public participation. We need a motion to adjourn. Commissioner Duje, seconded by Commissioner Leonetti. Please vote.
What a law firm that would be.
And we are adjourned.
See you all tomorrow.